computer. Okay. So good morning, everyone. I'm Martel Coke, the founder of BrownGirl and we're here with the BrownGirl members, and we're going to be discussing COVID-19 in the dental community and how we feel about the latest articles coming out and us actually returning to work as dental health professionals. Starting off, the discussion is going to be Wendy. She's a dental hygienist, and she actually came across an article that was very interesting that discussed about the dental community as we go back, what the practice settings may look like. That includes wearing N95 mask, having a infection control room where it's actually pressure, it's a pressure chamber, and some other fun stuff. So here we go. Hope you guys enjoy. Hi, Wendy.
Hey, Martel. Hey, everyone. Good morning or good afternoon. Thank you for doing this forum. Let me first tell you a little bit about myself. My name is Wendy Rogers, and I work pretty much in the south side of Chicago, the Chicago suburbs. I have two major jobs. One is an in-office hygienist. I've been doing that now for about 12 years. And my other side gig is with the school system. So basically, I work with a dental group that provides services to school-aged children in the south suburbs. We do sealants. Well, you know the gist of what that particular sector does. During my COVID quarantine, I've still been in contact with most of my coworkers. One of my coworkers forwarded me this article that really scared me, because in the light of how the COVID virus works, after reading the article and really coming to grips with how tiny the particle is, I started wondering, how is this going to change dentistry? Obviously, we can't do business as usual. We cannot be working so close to people, stirring up so many aerosols and not be affected or affecting our patients. So I was wondering what the thoughts were, if there was any chatter, if anyone heard anything about how dentistry may change, and just basically, how are you guys feeling in light of reading this particular article?
Well, I'll jump in. My name is Sonia Richards, and I've been practicing hygiene for 6 years. And the only chatter that I've seen about the changes have been in the various dental forums, the social forums, but nothing has really been said by dentistry as a whole, like by the ADA or anything like that, like what the changes are going to be. And I know that in the forums, we've all said we would love to have the proper masks. The article that you shared with us also mentioned like some type of air pressurized rooms and things of that nature. So I too am also anxious to see what the changes are going to be, because there are definitely going to have to be something happen. And I just feel like with some of the things they're recommending, what is that going to do for the life of a lot of dental offices? Are they going to be able to afford these changes? Are we going to be able to have an office to come back to?
Right. I think recently I've seen something that the actual CDC has recommended that dental professionals, because they're very high risk, they wear the N95 mask, that they actually have a gown on that they change with every patient that covers the neck and the wrist, that they wear gloves that come up over the wrist, and the gown actually has to go down.
A hazmat suit.
Pretty much a hazmat suit. They didn't say anything about the face shield, but then you have to think about people who wear loops. If you wear dental loops, dentists practice with dental loops, you can really wear that face shield because you just can't. So there are some new guidelines coming out, but we still have to keep in mind that every week, every day, this virus is changing. So at first it was, Only if somebody has symptoms and they cough and then you come in contact with those droplets, or you touch your face or your mouth or whatever, then you can get it. Now we're starting to read with this latest article that, you know, the virus can stay in the air for 3 hours, and that those particles, it's not just 6 feet where they can reach, but it's 20 feet where they can reach if they're aerosols. So in the beginning, we're over here doing profies, and I don't know about y'all, but I'm like this close. I can't see jack, and I don't have boots. I'm this close to people, and then I started like standing up and doing profies and just using my mirror and indirect vision, because it's like, it is very scary and you don't know who has it. And you're like, you have to use the Cavitron, especially if you're in some of those more poor communities where everybody has needs the SRP, and all these cases are very severe. It's like, you have to use the Cavitron. There's no way that you would be able to hand scale everything. So I remember like the mid-March, our office, we started by saying like, this is what we started doing when the virus first came out, and this is how dentistry is going to change. I feel like nobody knows what's going on. So at first it was the COVID-19 is here in the US. So okay, this is what we're going to do. It's not in North Carolina yet. Well, my state is Fort Bragg, so it's a military base. So they already said in the news, we are not going to put out there that there's a COVID outbreak in the state if it happens in Fort Bragg, where my city, not the state, but in Fort Bragg. So we had that it was in North Carolina, but they weren't going to put that it was at Fort Bragg because it's a military base. So they already said that. So it was here before anybody ever knew about it. So then they were like, well, you really can't do that because people have to be informed. Then they go, oh yeah, the first case is here. So here's what my office did. They were like, okay, we're going to start screening patients now, asking them, have they had a cough or have they been out of the country? Okay. People will lie because they want to get their teeth cleaned. So then like, oh, we're going to have somebody at the front desk taking temperatures. And then people at the front desk was like taking temperatures, like, I'm not trying to be exposed, and then they freaking out. So then we had people taking it amongst themselves to put gloves on at the front desk and put masks on at the front desk, and nobody else was doing it. So then everybody's looking like, well, why do you have on gloves and the mask? Like, what's going on here? And then it came out because the next day it's like, oh, more cases in North Carolina the next week. So then after that, they put a whole new memo out. Don't stand more than 6 feet between you and the other person. And we're like, wait, we're working like this, closer than 6 feet. And then they're like, oh, unless you're a hygienist or dentist, then the rule doesn't apply. And it's just like, you guys are not even making sense right now. And then it starts to become frustrating. And then you start to get panic. Like, okay, nobody knows what's going on. Y'all cleaning every hour, bleaching, wiping things down. We're running out of disinfectant. There's no Lysol in the stores. So everybody's wearing PPE. They're saying walk around with the mask at all times. Well, we have 50 employees. Everybody's going to be walking around with a mask. What happens when we run out of masks and the front desk people are changing their mask every freaking hour, and then we run out of masks because you can't wear the same mask. Everybody knows that it loses efficiency. So you can't wear the same mask in their regular mask. Are these even level 3 masks? No, because they ran out of masks a long time ago. So I'm doubling up on masks. I'm even using 3 masks because you can feel that the air is going in and out of the mask. And I'm like, oh my gosh, this is not the right mask. It doesn't say on the box. No, it doesn't say what type of mask it is on the box. So I'm putting on 3 masks while I'm doing SRPs. And it's like, now the panic comes. So then our dental office says, okay, so just don't use the Cavitron. If you guys want to work, just hand scale. And then the ADA comes out with stuff. So everything's happening in real time, and people are making these decisions for their practices, right? Just like that. So if you don't feel comfortable working, now you don't have to come to work. So then everybody's like, well, am I going to get paid? So there has been nothing in legislation saying about you're going to get paid if you don't feel safe to work. Your employee can fire you if you don't come to work, nothing. So then my office says, you know what? If you guys don't want to work, that's fine. You're not going to be penalized. If you don't feel safe, you just don't have to come to work. So now everyone's like, well, I have to work and I'm not going to get paid. So then it was like, well, if you have vacation, you can use it. So then the state mandated, not the state, but the ADA said the non-essential. You know, if it's non-essential, then don't do it. So that takes all the hygienists out. So then my office said, okay, we're just going to be open for emergencies. So all those assistants, all those front desk, all those hygienists, we had 12 hygienists. They're not working anymore. So as the ADA is putting more and more things out, we're just changing, but they're really not giving. It's just recommendations at this point, right? So it's not.
May I interrupt for a second? How long has your office been, I'm assuming it's closed. How long has it been closed?
It's closed for hygienists. It's still open for dental emergencies. Like there's.
Okay. For the hygienists, how long have you guys not been working?
I think it was like the 13th or 14th of March. We haven't been. So that was like right in the beginning, right? I feel like that was right when everything.
Yeah.
So everything's happening in real time and we're making these decisions. And then it's like contradicted because it's like the first responders, the hospitals, they don't have masks. These nurses and these doctors, they don't have masks. And then it's like, well, wow, should we really be open? But then again, if somebody has a dental emergency, they're going to go to the ER. And then you really don't want people going to the ER because that's how the virus is being spread, because there are actually people there who are infected. So then it's just like, oh my gosh, like, what do we do? So we don't know. And in my opinion, I said from the very beginning, like, it's going to get worse before it gets better. So they're like, everybody stay home, quarantine. Day 6 of me staying home, I drove to Georgia. I'm like, I'm about to go see my friend. I don't know if this is the end of the world. Like, I just want to play patty cake one more time. Like, I was out. But, you know, even when I drove to Georgia, they were letting people buy alcohol to go. So things were already taking place. And that was day 6 of quarantine. That was like March, maybe the 21st. That was March the 21st. So everything is changing. And now look, people are afraid to go out. People are wearing masks. People are holding people hostage. And then we don't know what it's going to be like for the dental community. Like our dentists, some of the smaller practices, I feel like those are the ones who probably couldn't afford their hygienist to begin with. When you go back, they probably won't be in business, God forbid, or they're not going to have a hygienist. These doctors are going to be like, I can't afford my hygienist right now. We lost a lot of money. I got in a lot of debt, unless they got some kind of loan relief, which I know nothing about. They're probably not going to be able to afford a hygienist, and a lot of hygienists are going to be out of work. I was at my job for 7 years, and I was the lead hygienist, and we had 12 hygienists. And I don't think as soon as this is over, we're going to be going back to work, because what about the PPE that's going to be required? What about all the guidelines? If we do need a pressurized room to handle those aerosols, or are we going to be out of N95 masks? Are they going to cost so much money? I read somewhere that they used to be 85 cents. Now they're $7 per mask. They used to be 85 cents. Now they're $7 per mask. Are dental professionals, offices, companies going to be able to afford PPE? Is it going to be one mask? Because I'm still bugging that these nurses and hospitals are getting one mask, because if the virus comes in contact with the mask and it's whatever material, and it can stay on material for 72 hours, then if you're taking that mask home and touching it, like, I'm just confused about that part. I don't know. There needs to be a whole new infection control, and OSHA needs to be revamped. Obviously, it's going to be for the whole dental community. But most importantly, I feel like the biggest thing is when we go back, dentists are going to do, like, our position in our profession is going to be in jeopardy, because a lot of dentists are going to be doing the prophies, the SRPs, the sealants. They're going to be doing them themselves. On the brighter side is nobody's getting dental treatment right now. So all of those patients that aren't having treatment, we're going to have an abundance of those patients, but at the same time, people are going to be scared. Like, think about our perio patients who are older. They are going to be scared to come back to these offices. People who have a weaker immune system, that have allergies and other conditions. You know, Sonia, like you, I know you shared with us that you had lupus. What about people like that have these autoimmune diseases? They're not going to be the first ones to hop back in the chair, because they're already scared. And most importantly, like, talking about us in this platform for BrownGirl RDH, there was just something on the news that African Americans are dying at a higher rate. So it's like, oh my gosh, me as an African American, and if I already have anxiety, am I gonna wanna jump back into the operatory knowing that my dentist is not equipped? Because at this point, it's all recommendations. So the CDC or the article can say, we recommend that you guys have pressure sensor rooms that's gonna reduce the amount of aerosols. It's a recommendation. Nobody's saying your office has to have this. How much is that gonna cost? My little dental office is not gonna be like, okay, we're about to get this $30,000 room for one hygienist. Like, you better have 7 hygienists up in that room. There's gonna be a whole bunch of aerosols in there. I'm not about to die in that gas chamber with aerosols. Like, I don't know what's gonna be happening, but it's definitely gonna change, and we're not gonna be going back to work immediately. So the best thing for us to do, I feel like, is try to figure out what you're gonna be doing when everything comes back. Like, start building your resume, start going into things that.
I don't really think that they have all of the information, and I think that's also going to play a part into how things change. And but before I go on, my name is Elvina. I've been a hygienist for, I think it's 20 years, 19 years, somewhere along those lines. And I do
20
work in
this year.
20. I work in a private practice, and then I also work as an instructor for hygiene students and dental assisting students. But just looking at all of the information that they've been out, a lot of it is just guessing, even with the CDC. They just don't know. You look at one country and they're talking about how the aerosol, they were showing in England or something, they made like a report, and they were saying how far that the particles spread. And then when you listen to the guidelines over here, they're saying something different. I think that once they actually figure out what's going on, how it's spreading, and how we can prevent people from getting it, things will change. And as those changes start to come into play, then we'll have more recommendations for what we need to do in our practices to make sure that we're safe. But I do agree with you, because my son, he takes 3 different steroids. So I'm not a person that would probably take him in for cleaning. But on the other hand, I look at all the patients that were upset when we were canceling their appointment because we were closing the office. Some offices will survive, but you will have a decline in patients and offices that are going to and what we need to make sure that everybody is.
I think a lot of that patients that were being upset that their appointments were being canceled, that had to do a lot with just not knowing and being uneducated. A lot of people,
I agree.
A lot of people don't. They don't take it serious unless it hits home. That's for a lot of things. Even me, I was like, yep, I'm driving to Georgia. Yep. But now that I look at it, like, I'm not going nowhere. Like, I'm going to stay my butt in the house. So a lot of people, including myself as a health professional, was like, no, it didn't affect. And then I started seeing, people saying, like, sister got COVID. Because then I was in my mind, I was being very ignorant. I was like, this is make-believe. I don't know anybody personally that got COVID or whatever. I'm like, do you know anybody personally? And then come to find out, people weren't sharing. Hygienists that were actually getting it, they were not sharing it. They were being scared to share it. And one of these girls that I know, one of the BrownGirl members, she actually had it. And I talked to her days before she actually was diagnosed with it, because she had it before she knew. They told her she had pneumonia. Then her checks, they said her chest x-ray looked fine. And then when they actually came out with the test, because they didn't even have a test for it, she tested positive. And she's like, she had to go back, and all the offices that she temped with, I don't know if you guys saw heard the video that we did, or saw the video, we posted it on YouTube, but her name is Sabrina. She was the first dental hygienist that actually came out and it explained in details like what happened. She's coughing in the video, and it was just like, wow, that hit home for me. Like, we can definitely that she's 100% sure that she actually got it by doing hygiene. And she probably did, because you contract it, symptoms show up 14 days after. So counting 14 days prior, I don't even know what I ate yesterday, let alone the patients that I saw. So, it was very concerning for me, because I'm like, oh my goodness, after this, is she going to have to disclose that she had COVID? Is she going to be discriminated because she had COVID? You don't even know if once you have the virus, is it out of your system, or are you a carrier, like tuberculosis? We all had to get the TB skin test. You test positive, you got to go get a chest x-ray, even if you don't have symptoms. I'm not saying that's what COVID is, but like, we really don't know, because it's still happening. The virus is getting stronger. That's what I do understand. And that's what viruses do. They grow, they get stronger. That's why it's so hard to find a vaccination for a lot of these things. But I really do hope that this is not, this is just a month in, 2 months in. So I really do hope that it goes away, just like in China. They're saying like there's almost no cases of it in China, but people just need to try to flatten the curve. There's a lot of people doing a lot of stuff. The parking lot at Lowe's and the grocery store is full. I'm like, what are y'all doing? Like, y'all building an underground tunnel? Like, why is y'all here? Like, all I'm trying to do is go and get some laundry detergent. but people are really just out because they have nowhere else to go. So I really do hope this is over before it gets really, really bad. I just don't know. This is just, it's just horrible. It really is.
I guess my concern at the very end of all this is certainly OSHA is going to probably be cracking down a little bit more on standards. I'm hoping that they'll be visiting a lot of them, because I've worked in some offices that, if OSHA came through there, yeah, they wouldn't be in business. But again, I'm hoping that certainly they can't not visit some offices or be a little bit more vigilant about making sure that the standard of care that most dental practices provide is within reasonable level.
That's gonna come with OSHA is not gonna go to every single dental office. So
they probably won't, but I would hope that they would, in light of how contagious this virus is and how close we work with our patients, certainly something has to change.
Yeah, there are going to be changes, but changes, they do take time, and we just need to be our own advocates. If we go into these offices that are, that should be shut down, are we going to finish out our entire day there? Are we going to report them? Are we going to say anything? Are we going to say, I'm not going to jeopardize my health or the health of these patients that you want me to treat? So we just have to be our own advocates and take a stand. And a lot of hygienists are not going to do that. They're not going to do it. It's like, okay, let me leave this office. And okay, how many times have you seen pictures in these dental groups and these forums of like, look at this office that I went to, they're using this and that. And it's like, well, they're not going to say that they reported them, but did they even think about it? Or did they say, I'm never going back there? What about the next patient that's there? One of the girls shared something that her patient asked her about treatment, that her dentist didn't tell her that she had perio, one of the patients. And she's like, should I tell her to get a second opinion, or is it not my place? Like, we have to deal with those ethical dilemmas. So if this post-COVID, if we go back and there's supposed to be something that is a standard now, a new standard according to the CDC and OSHA, are we going to take a stand and say, you know what, this is not right? Because a lot of people are in fear of losing their job. And what if there aren't a lot of hygiene jobs? Are you going to be like, you know what, this is just my job, I'm going to do my job and go home? Like, I've been there where I'm like, I don't get paid to do this, they're paying me to do this, or I voiced my opinion and I was told, you don't get paid to ask questions. So what do I do? Do I want to keep my job, or is it not worth it for me to go back? So we just have to make a decision.
Can y'all hear me?
Yes, we can.
Yes.
Well, me being a temp hygienist, I have dealt with this a lot. I have been temping since I graduated. I'm Chardonnay, by the way. How's everybody doing? I've been a hygienist since 2017. I graduated May 2017, and I've been a temp ever since then. I've had times where I also worked in the school systems, and I did the sealant programs at CPS schools, and I've continued to still temp even through that. So for me, I have personally dealt with so many offices with ethical problems, and I felt like they were doing substandard care. And sometimes I feel like it's hard for me because it's like I have to choose my battles, because at the end of the day, I'm not necessarily their permanent employee, but it's also my right and my duty as a hygienist to do what's in the best interest of these patients. So I have personally said some things to the doctors and even the office managers, and they looked at me like, well, how dare you? You know what I'm saying? You don't work here. But at the same time, I'm a dental professional just like you are, and I know what's right and what's not right. And I have called on and reported some officers because I saw some things that were very non-ethical. I have also told my temp agency, and they just basically give me discretion, say, hey, well, you don't have to go back. A lot of these offices, unless they're getting held accountable on a higher level, they're not going to change what they're doing. And that's just from experience. I know they're not. A lot of offices have some doctors where they want to cut corners to save costs. And that's where a lot of the substandard care, I feel like, is coming from. They don't have adequate infection control, or they might not have the disinfecting or proper waterline tablets to go through, and they say like, oh, well, we use this instead, knowing that that's not created to kill off and be able to limit the number of microbes going through these water lines. It's a lot of offices that are using like regular, or I would say that disinfectant wipes that are not made to kill off certain things that we could come in contact with, like bloodborne diseases. And it's like made for regular household items. So you want to clean off your counter, you're using that to clean blood in a dental office. That's not the best standard, I feel like. And I personally have went through that a lot. And I'm one of those type of hygienists. I really care about the patients, and I really care about their care. And I've even went so far as to telling some patients sometimes, like, look, I don't work here, so if I tell a patient something and I feel like it's what's best for them, and they go back and tell the office that, hey, this hygienist said this, I'm not gonna be upset. You know why? Because I don't have to go back there, and they, quite frankly, they can't fire me. So I have had times where I had to bite my tongue, and I've had times where I'm like, no, I'm gonna speak up for this patient. And I told the patient, like, look, this is what's happening. I think that you should rethink coming here. I've went to offices where doctors literally didn't even come in and do exams for their patients. They did the initial exam, and then every other periodic exam, they let the hygienist do the exam. And it's like, okay, we can do a dental hygiene diagnosis, but at the end of the day, why are you not seeing your patients? Every time their patients come in, they walking them out for periodic exams, but the doctor's not even doing the exams. And I'm just like, what is going on? And then I saw a patient, she had a recurrent infection underneath a crown that the doctor never caught because you're not doing the exam. And then you're relying on the dental hygienist to do the exam. And I told her, I'm like, this is unethical, and you know it. She gets a piece of paper in front of me, tells me what a dental hygiene diagnosis is, and tells me, well, are you not comfortable doing your job? I said, ma'am, I know my job, but I don't think you know yours. It's your duty to do exams for your patients every 6 months. And you're coming telling me, yes, I appreciate that you trust my judgment, but at the end of the day, you still have to come after me. You're the doctor, and you're in charge of this practice. You still have to come after me, do your exam, build your rapport with your patients, let them know you care, look in their mouth, and then you're charging them for dental exams done by a doctor that you're not even doing. It's not okay. So I personally have had a lot of that happen, and I've reported sometimes, and then sometimes I just speak to the doctors and hope that they change, and sometimes I might talk to the patient individually, you know, on the low, and tell them, like, you know, this is what's going on. You need to be careful about what you're doing, or they recommending this treatment for you. They're not recommending this treatment for you, but I saw this on your x-ray, or I saw this in your mouth, and you know what I'm saying? So it really is a big thing where you have to kind of choose your battles.
And be your own advocate. And that's what a lot of us, I feel like we do. We tell our patients, we have that relationship with them, and we tell them, like, you know, they didn't say this, but this is what I see. You can always get a second opinion. I don't come out and say, like, you have a cavity or you don't have a cavity. I always say, like, I would get a second opinion. Anytime I do anything with my health, I get more than one opinion. And that's what I tell the patients, just to cover it, like yourself. You're not telling them anything wrong. You're just saying, like, you should always get a second opinion. That's the rule of thumb. So, and that's really good, that everything that you said, like, I see your passion and everything, but you graduated in 2017. So this is something that new graduates can take into consideration when they're watching. My advice would be, whatever they taught you in hygiene school, go by that standard. What if they say, you know, you should be changing your water bottle out, throwing that water out at the end of the day, and the dentist is like, that's our distilled water that we pay for, just keep it in there all week. You use that same standard, because one thing I do know is that in hygiene school, they're going to teach you what you should be doing at all times, and they're going to go by the book. And a lot of people, when you start temping at a school, they're like, oh no, this is the real world, you don't do it like that. No, everything they're teaching you is the right way to do it. Like, it might be overkill sometimes, but if you just think about what you do see, this is the reason why it is overkill. Because if they're teaching you how to do it at a certain standard, you're gonna know, let me wipe my room from the top to bottom, the cookie crumbles from the top to the bottom. You're not gonna be wiping the chair and then go wipe the light handle. Like, that's not what you do. Or you're gonna wipe twice and wipe and spray. Some offices are like, oh no, you can just wipe it once. And you're looking at the cabbie wipes like, this don't say nothing about one time, you know. And then it's like, okay, and then you just take into consideration, you come in my room, you're gonna be coughing because I'm spraying cavicide everywhere after I wipe. And I've been in some offices when they're like, oh no, don't wipe the chair with the cabbie wipes because it's gonna mess up the material.
Mm-hmm.
And then you're like, you go in a room and you see there's dry blood on the chair because they're not even wiping the chair. They're saying don't wipe it with the cabbie wipe, but what are you supposed to be wiping it with? Oh, soap and water. Is soap and water killing that blood? No, it's not. So I don't care. I still wipe the chair with the cabbie wipe. I wipe it. I wipe the bottom. Plastic's cracking. I don't know how that happened. Like, I mean, protect your patients and, you know, hold yourself to a standard. When you go in that room as a new hygienist, you know, say, or even a hygienist that's been doing it for a while, clean that room like you're going to sit in that chair next. Like your kid is
Right.
like your mom is going to sit in that chair next. That's how I always clean my room. I remember having a patient who was like a doctor or a nurse or something, and I clean my room, and you know how you like clean it and then it kind of like drips, like if you wipe and the wipe isn't like all the way dry or whatever, and it drips on the chair, but then you don't get it off. This lady came in my room and she was like, is that pee in the chair? And I'm like, and it just triggered me because it's like, one, don't disrespect me like that. Like, you're looking at me asking me, is that pee? Like, I'm gonna put you in a dirty room when I sit here and I pride myself on how I disinfect the room, like to make sure that you coming in, I don't even know what you look like, but just to make sure you, the next patient that's coming in, is going to have a room where they're not going to contract anything from this room or my operatory. So it's like, people are going to look at you anyways, like, oh, you're young. How long have you been doing this? Did you do this right? Are you sure? Like, the last person didn't do that. Like, we always have those things. Like, the last person didn't probe, and you looking at me like, I'm doing something wrong? Okay, take this referral, and I'm going to send you to a periodontist, and they're going to tell you how much gum disease you have and how long, because the last person didn't tell you who was your hygienist for 15 years, who didn't look like me. So just always hold yourself to that same standard as a new graduate, or even, you know, going into a new practice, because a lot of us aren't going to have our jobs when we go back. Let's just put that out there. And you're going to have to find a new job where they're doing things very different, where they look at you very different. So always come correct and come with that standard so that nobody can tell you. And document. You know, if a doctor didn't come and do that exam, I did my exam, doctor did not come to the exam, you can't tell me what I'm going to put in my notes. And a lot of times those softwares, if the doctor goes back and I've had people delete my note and then it shows up as deleted and who deleted it. I'm like, you're dumb. So you really went and deleted my note, and I would take a picture with my phone. Yep. And I have that right in there. Always protect yourself at all times. If something happens, they're going to come after you and your license, and you work too hard to get that dental hygiene license. So always, and if you suspect someone's going to delete it, take a picture of it. They're not going to know you take a picture. And don't tell nobody. Don't be like, hey, girl, guess what just happened? Because people will switch up on you and be like, yep, she did this. And then you'll be getting called in the office and fired, and you don't even know why you're getting in trouble. And it's because somebody done set you up you don't even know about. So protect yourself at all times. Don't trust nobody. I'm just going on and on and on. But let's get back.
Have y'all ever had to report any officers, or like, have y'all ever felt like y'all need to like tell like what they've been doing?
I felt that way, but I've never actually done it. So the fact that you've actually done it, like, I see your passion, and like, that's courage for you, because I've never actually done it. And I feel like it's usually those offices that you do temp in, but then in the back of your mind, you're like, I know somebody else had to have said something, but probably it's your responsibility. So I'm saying, like, even if I don't do it, like, use it as your responsibility to do it. Cause I have been there and I haven't done it, just because it's like, oh, well, you know, I don't work here. It's the same type of mentality, but we really do have to start taking it into consideration.
When I tell y'all, like, as a temp, I've run into so many offices that are not doing what they're supposed to do. I thought about even creating a show where basically like I go in and basically like, you know how like they have those shows where people come in and they do undercover or they like investigate on the inside of business. I've literally had this thought run across my mind so much like this. Patients have no idea what's going on in these offices, and it's so terrible because people putting their health at risk. People have pre-existing conditions. People's immune systems are compromised, and they have no idea. Like, how do y'all feel? I know a lot of offices don't do this, but how do y'all feel about barriers and putting barriers on like your syringe tips and your Cavitron tips and like basically putting barriers on everything that you're using?
I put barriers on everything because that's the way I was taught in hygiene school. And
Me
I'm the
too.
only hygienist in my office that does that. No one else does it. And when they clean their room, I'm telling you, they're done in like 50 seconds. I'm like, how are they done? How are they done? You know, and they laugh at me because I barrier everything. But I bet my patient feels a lot safer when they're in my chair.
Because that's what I would want somebody to do for me too. Like, I just, it's always freaked me out. And I go into every office, I'm like, do you guys have barriers? And they're like, oh, no, we don't. Well, guess what? I'm about to use a sensor cover. I'm about to do something because it just makes me feel better knowing that I'm not spreading as much blood and germs all over the equipment. And then it's like, this equipment ain't being sterilized. Like, we wiping this stuff down with alcohol every day. Alcohol every single day. And it's like, I've even had one doctor that was passionate as I was. He's like, can you please make sure that every patient has barriers? I'm like, look, you ain't got to tell me twice. I already be on it. I come in here, that's the first thing I'm looking for. So, and these contact surfaces coming in contact with alcohol, it's not like people are rinsing with soap and water. Alcohol dries up, and I just feel like I don't know, it freaks me out a lot of times.
I think you should bring, you temp a lot, so you see a lot, so it triggers you. Like some people, they don't temp and they're like, oh no, it doesn't bother me as much, right?
Yeah.
But, you know, bring your own up-to-date CDC OSHA regulation manual and be like, this is what the standard is. This is what we should be doing. This is why we should be doing it. Sometimes you tell people, oh, you need to do that. You know, don't turn right on red. And people are like, why? I turn right on red all the time. It's like, because there was an accident here. This person turned, like some people have to know exactly why. So it's one thing to tell people what they should be doing, but it's another thing to tell them why. So I think a lot of us, and a lot of times even humans, they're like, don't do that. You grow up, your mom says, don't touch it, it's hot. And then you're like, why not touch it? Because you're going to get burned and you're going to hurt yourself. So people nowadays, they need to know why. So have your manual, you know, if you know you're going to be temping, and just be prepared to come in to something that is not standard and say, you know what, this is the standard. This is how we were taught in school. The standard hasn't changed. Boom, 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 boom. You can always do that. And then they can't deny evidence. You can't argue with evidence, right? So it's just like, it'll just shut them up. And they can't say, oh, well, this was written in 1986. No, but this was written like last year and it been updated this year. So how about that? But yeah, so that's something. Armani, I know you are a senior. You're a senior student. So this is definitely something that you can start taking into consideration, something that they won't necessarily tell you in school. Like, these are real hygienists that are here that are dealing with these things. And if you go into the workforce and post-COVID, you need to know how to protect yourself. You know, it's not going to be glamour. But then again, you're like, oh, I got this job. You know, I was working at not the Gap. I was working at Home Depot before I became a hygienist, and I was making $12 at Home Depot. And then I started working as a dental hygienist, and I was making $32 in New York. And I was like, I wasn't going to do anything to risk my job. So whatever they was doing, I was like, okay, like anything. I remember I told a patient, he was acting very hyper. His mom was like, I didn't give him medication. I don't think he needs his medication anymore. And I just put in my notes, patient was acting very hyper. Mom said he's not on medication. I beg to differ. I was like putting all these things, and I got in trouble, and I got called in the office, and I thought I was gonna get fired. And I had that was like a near-death experience for me. I was so like, oh my goodness, if I get fired, like what am I gonna do? Am I gonna go back to working at the Home Depot? Like I was stressed out. So it's like, in my mind, I did not want to lose my job. And I knew this was like the only opportunity. I knew all of my hygiene class graduated and everybody was fighting to find jobs. And like, I didn't want to mess it up. So like, just think about, you know, those situations when people go into it as a new graduate and they say like, oh, here's your mask that you have to wear. And you're like, wait, this isn't an N95 mask, you know, or, you know, then are like, what situations, and I'm not saying that's going to be a situation, but what situations can you be put in and how are you going to handle them? Is it worth it to say, this is not right, this is the standard, and then they accept it and receive it? Or are you going to say, this is not right, this is the standard, and they're going to get offended and say, well, you're not the right fit for this office, you know? So just be
Right.
Be prepared to handle that. And then if you are, what are you going to do? What's going to be your backup plan? All right, have a relationship with the temp agency already. So if you do end up getting called into the office and getting let go, you already have a relationship with the temp agency where you can say, you know, okay, I'm available to work now. Like, build those relationships prior to, because you're not going to know what you're going into. Yes, I might have a job, but I also have a backup plan. You know, for them one time, do a really good job before you even start working in private practice, so that they know, okay, this hygienist is actually professional. They had a don't wait until after to start building relationships with temp agencies. You know, get that in the bag now. Get your resume out there now. I'm going to be graduating soon. I just want you guys to have this. Start doing that right now. Start even making little business cards like, you know, your name, RDH, new grad, I'm available to temp. Bring them in dental offices. Sometimes you don't even have to go through a temp agency. You know, I work for myself. I'm an independent contractor. I live right up the street. I know a lot of patients in this community. I do a lot of events. Call me if you need me. And that goes.
I do have a question about that too, about forming a relationship with temp agencies. I do have, you know, a lot of info, and I am going to look into that because that's what I want to start with. Let's say, you know, like Chardonnay, I'm having some problems with dental offices in terms of, you know, their compliance with infection control or something like that. And let's say me bringing it up result in me being let go. And let's say this happens a couple times. Would that affect my standing with the temp agency if they're, you know, getting me to these offices, but here and there's some problems? Or is that not something I would have to worry about really?
From my experience, I've worked through DAPS, which is Dental Auxiliary Placement Services. They've been around for a long, long time. And when I tell you, like, they do not care. They don't. They about their money. And they feel like, okay, if this office don't want you to come back, we're going to send you somewhere else. I can honestly say I've never had a problem with getting work through them. Because they have so many clients. They have so many offices. They're very, very, very established. They don't have as many offices in the suburbs, like if you live in a suburban area, but I know for like Chicago, they got offices all over that they've had relationships for 15 plus years. So I've never personally had an issue with not being able to find work through them. If anything, I've declined a lot of work through them because I didn't want to drive as far. You know what I mean? Because they do have a lot of offices that are really far. But no, they keep their relationships separate between like their dental professionals and their dental clients. So if an office don't prefer you, they'll just simply say that they don't prefer you at that office anymore. Or the same thing with you. I've had instances where I tell them that I would rather not go back to this office. And that's another way how I deal with things. So if I can't compromise, I will compromise my values and my ethics as a hygienist. I'll either speak on it to the dentist about it, which I have a lot of times, or I'll simply just, you know, keep my distance and not go back. And I'll tell the temp agency, like, I'd rather not work for this office. You can either disclose to them why or why not. And a lot of times, if it comes down to pay, like there's some kind of discrepancy in pay, they're supposed to pay the same day and they didn't, or stuff like that. The temp agency will fight for you. They will fight for you. That's what they're for, to represent you, to make sure that you get the compensation you deserve and that you get the hours that you want to work. So I would say that start off with a temp agency in your area. First off, I don't know where you live, but there are different agencies. But I have the most experience working through DAPS. And I know that They won't hold anything against you if the office don't prefer you back. They'll just send you somewhere else.
So, Armani, let me just say, I know you've heard a lot of negative comments because that does happen. It happens a lot. I've been practicing. Elvina and I graduated together, actually. So I've been out here for a long time, too. And I actually worked for DAPS when I first graduated. So, yeah, they've been around for 20 plus years. But for the amount of negative offices you may encounter, there are a lot of really good offices, too. So I don't want you to concerned about going out and thinking you're going to run into a bunch of offices where things are going to be so bad where you may get a bad name. The key takeaway is to remember your ethics and to remember that, you know, you matter too. So you don't want to go, if you have to tell them about 5 or 10 offices that you don't want to go back to because, you know, they were unethical or whatever the case might be, then let that be what it is, because at the end of the day, you matter. You don't want to be in offices where things are unethical and you don't say anything and then your name is now attached to it because you signed off on some notes or something like that. And, you know, this patient go back and sue because, you know, they caught an infection or something like that. Your name is attached to that. So don't be afraid to, you know, what may happen if you say something negative about a couple of offices that have been doing something negative. You matter at the end of the day. So just know that as long as you are doing what you're supposed to do, remember what you've learned in school, like everybody else has been saying, make sure you're wiping everything down and, you know, just doing what you're supposed to do. You should be fine. Don't worry about, you know, what the back end is going to say. Don't worry about all that. Because other than that, you might as well find another profession, because there are going to be a lot of offices that are not doing what they're supposed to do or are not doing everything by the book exactly. You know, there may be some areas where they're doing barriers, but they're not putting barriers on everything. You know, you have to make some decisions on, you know, what you want to complain about and what you don't want to complain about.
Can I just piggyback off that a little bit? Sometimes it's not also that the office is just doing bad things. Sometimes it's just that they're not keeping up with the standards. You know, we're talking about barriers, and there were a time when people didn't use barriers. And if they're not continuing with education classes in those departments, then they just may still be doing things the old way. If you come into an office and you find that, sometimes instead of saying, oh my God, you don't use barriers, it's more of, you know, let me, you know, talk to you about barriers and how it can help the office. You'd be surprised at how many offices actually do listen to us. Sometimes it's not, it's just our approach. You know, if you come in with that attitude, then you tend to get shot down. But if you introduce them a little bit at a time to change, then a lot of times you'll find that they will change. And I'm not saying all offices are like that, because I've worked in good offices and bad offices. I have temped. I don't temp often because I just find that temping isn't for me. I don't like walking into the unknown. But I remember when I graduated out of hygiene school and I first started, I temped for an office and I didn't like it and I wasn't going to go back. And I went back anyway. And actually I ended up working for that dentist for years, and he made a lot of changes because of me. So that's just my take on it.
Right. I saw a post.
Thank you.
You're welcome. I saw a post that said the dental offices that have been doing right by their patients and that have been, you know, the good offices, right? These are the offices that are going to last through this thing. The ones that have been cutting corners, doing things under the table, not so ethical things. Those are the ones who aren't going to necessarily come out. So hopefully we won't have anything to worry about, because you think back and you're like, wow, I wonder, and Chardonnay, you probably thought about this, like, I wonder what happened with that patient that they said needed a root canal, and it probably was the filling, and the doctor just did a root canal because it was more money and they can bill Medicaid. And you sit there and think about that, like, what could I have done? Like, should I say, hey, follow me on social media, like, keep up with me? Like, you know, like, you're not allowed to do that professionally. But I'm just saying, like, you ever sit back and wonder, like, oh my gosh, all of these kids were in this pediatric office or we're in the sealant program, and look at these sealants where they're probably going to come off when the kid gets off the bus that they just put on. Like, those are the things, like, am I a one person that can make a difference? You never know. You never know.
Mm-hmm.
So just keep that in mind. I don't think we'll have anything to worry about long term. Like, we're going to see who's going to come out of this. Patients are going to come back if they love the office, if they're being treated right. Patients won't go back if there was any kind of like, well, I remember how they made me feel, so I'm definitely not going back there. So there's an opportunity for us and for practices too, but like change a lot of how they're doing things and how they operate. I'm excited to see how this post-COVID thing works out, because I feel like it's going to be for the better, but it's definitely going to be some changes. We're definitely going to have to adjust. There are going to be stubborn people who are like, I'm not doing that, I'm not doing this, but we'll see what happens. I'm just glad that it's not the end of the world, as we know. And I'm just happy to actually be in a profession where we can make change. Like, we can do it. I don't know what's going on with the clinical boards for the seniors. I haven't been up to date on that. I did see a petition where they were trying to sign off so that students didn't have to take their clinical boards. I don't know what that all entails. But it's going to be a lot of changes for sure.
I would definitely say, just to end off, like how I feel towards people protecting themselves, no matter when you graduated or no matter how long you've been a hygienist, even if you want to go into the field where you're temping, I always just feel like you should be the change that you want to see. So if an office is not compliant with what you believe, protect yourself. If they're not giving you the mask, go buy your own mask. If you don't have the right instruments and you feel like the instruments are dull and you still got instruments and you feel like they're good, ask them, is it okay if I bring my instruments? Sometimes by just making changes for yourself, they respect that. They like, okay, they gonna do what they gotta do for these patients and for themselves regardless. And a lot of times they end up coming around. I've had a lot of places where I've been where they like, I really respect you and I'm gonna consider this in the future. And I've had a lot of offices where the doctors oftentimes, they check themselves, whether they say it to you or not. Once they realize that you are still going to stand strong on your integrity, whatever that might be, it don't have to be something so deep, but it could be something small like wanting barriers for your patient or wanting disposable napkin wraparounds for your patient, because some people freak out about just having a bib and wiping it down all the time. You can't sterilize. Some people want disposable ones because the aerosols and all that stuff is affecting everything. And some people, they buy their own stuff, or they make sure they got what they need, or they make sure that they give the patients the adequate time they need. If they're giving you 45 minutes for a patient and you need a full hour, speak up and say, like, look, I really want to be able to give this patient the best care that they need. And every patient is not the same. And that's something that I tell doctors and I talk to them about, and they understand that. A lot of times doctors are a little more understanding because they are clinicians as well. And sometimes the front desk people just don't understand that all the way because they front desk. And it's like, yeah, you front desk, you making appointments, you know these patients, but you don't know their mouths like I do. And you know what I'm saying? A lot of times when you talk to doctors, they are very compliant, especially if they like you, or especially if they see that you're a good worker. They don't even have to like you, but they're going to respect you because they know that you're doing what you got to do.
So somebody called me the other day. I didn't even know who it was. And she's like, hi, Martell. And I'm like, this is Nikki. I'm like, Nikki? I don't know Nikki. I'm like, okay, whatever. Let me just act like I know this person. I have my phone number. She's like, called me and she was freaking out, and I can hear it in her voice. And she's like, I just need to know, like, what are the latest protocols for classifications for perio? Because, I'm working with the resident, and the resident is saying that this patient does not have perio, but they have bleeding and they have spurs and they need an SRP, and the resident is saying it's a regular prophy. Like, what do I do? And I was like, first of all, just calm down, like, take the emotion out of it. Like, go back to what you learned in school. Take the emotion out of it right now. I said, if that dentist is telling you to propose a prophy for this patient, I said, you need to document. Do your probings, take your x-rays, chart attachment loss, have all your documentation in there. Document next visit per Dr. So-and-so prophy. I recommend, and I've educated the patient on periodontal disease, what classifications are, what we recommend, what the Academy of Periodontics recommends, and put that in your notes. And she said, so what do I do when I bring the patient back? Do a prophy? I said, no, when you bring the patient back, start by cleaning one quad or wherever, however far you can get. Don't clean the whole mouth. Do an SRP on the patient and then put in a chart. Don't put prophy. I said put the scaling actually took longer. Patient needs to return for a second visit. When they come back for the second visit, scaling took a little bit longer. Bring it back so that you know that you did a scaling. You're not saying you did a prophy. You're not billing out for a prophy or anything. Just say you didn't finish the appointment because it took longer than what it did. And I don't know if she did it or not, but your doctor is telling you to do a prophy. I would start that prophy and just be like, we ran out of time. And you know what? You just got a whole half side of your mouth cleaned in the amount of time that you had to do a prophy. So I told her, like, that's the way to get it. She didn't want to speak up. She didn't want to do against what the doctor recommended because that was the doctor. Well, it was a resident, so they weren't really a doctor yet. But what I told her was that resident probably felt like she's a doctor, that she knows her stuff, and she probed, the resident probed, didn't chart, and she said she got 2s and 3s, and the patient was a regular prophy. Well, when this came to the hygienist, she said she got 4s, 5s, 6s, bleeding, calculus everywhere. So she brought that to the dentist, and she said, the resident dentist, and she's like, well, I probed, and this is what I got. So I said, that provider probably took it as you're telling them, how did you get these numbers? And they probably took offense to it. So it's like, do the prophy because I said do the prophy, and that's what I got. So I said, okay, if you got that and she got that, put in there. Dr. Spot Probe said she got 2 and 3 millimeter pockets. These are my readings. Like, always document. You don't have to argue with that person and just take the emotion out of it, because what you're going to end up doing is getting really heated and doing something, and you're not going to be able to focus, or saying something that's going to backfire on you. So you might be like, oh, she said do the prophy, I'm gonna do the prophy just because they said do the prophy, but just take that out of it, because we can get that way. Like, it's your practice, you're the dentist, and I'm gonna put it in the notes. No, do what's right for the patient, and, do half a mouth, scaling, don't put prophy. Ran out of time, I need to come back and finish. That's why your notes reflect what you did, because at the end of the day, nobody saw what you actually did. Take post-op x-rays. When that patient left, before the patient left, take an x-ray and say, you know what, this is post. Probe afterwards. Probe when they come back. Like, document. So when it comes down to it, that dentist, that resident dentist can say, you know what, this is my notes. I did an exam, I spot probed or put PSR scores, whatever they did, and that's all they had to stand on. Whereas you had all of this evidence. Wow, she brought this patient back multiple times. Wow, she took post-op x-rays. Wow, she probed multiple times. She documented in her chart. Why did she do all this? Then you go back to the doctor's notes. Oh, because the doctor spot checked and recommended a prophy. So it might take a lot of time, but you're not doing anything wrong. If they look back at your notes, all they're seeing is that, oh, she ran out of time with the prophy. Or the scaling. Don't put prophy, because if you put prophy, that means the patient's healthy and they're just getting a regular cleaning. But don't put what you did. I did a scaling. Like, during the debridement, I only got to quads 1 and 4 or whatever, upper arch. So just, you got to figure out ways around it and just try to take the emotion out of it so that you can actually think about what's going on, what is the dilemma, how am I going to fix this? What's in the best interest of the patient? And how do I protect myself? So if you think about all of those things, then you cannot go wrong at all. But if you just call in Martell from BrownGirl RDH to ask what the perio classification is, isn't going to help. I'm going to be like, what are you talking about? I'm going to give you what you asked for. Like, what the perio classifications are this. But did that help your situation? No, you just wanted to be heard because you felt like, I'm right, she's wrong. I need somebody else to say that I'm right. I don't know what's going on, girl. How'd you get my phone number? Like, I'm like, who? What? Do what?
In a situation like that, like if the patient needs anesthesia and you want to just go through with it, you just have to go back to the doctor. Oh, the patient's uncomfortable for this procedure. Can we just recommend anesthesia? Or can they sign off on that or whatever?
If the patient is uncomfortable and the patient needs to be numb, the doctor should numb them. No patient should sit there and go through, even if they have a regular clinic and they have a lot of inflammation and it just hurts. They should have that option. It's free. We don't charge for it. I don't know in different states if they charge for it. Some hygienists can do it on their own. They have other things like Orchix where it's not an injectable anesthesia, it's a topical anesthesia that you can apply. So you just put it in the sulcus and it'll numb the patient's gums. I never felt like that actually works. Some people said it does work, but if a patient is uncomfortable, that comfort should come first. Like the doctor should have no problem with saying, yes, I can come in there and numb that patient for you. I've never had an issue with that. You might wait, because they know they're not getting anything out of it, but no, it just depends on who you work for. But don't ever let a patient go through a cleaning where they're uncomfortable. It makes me uncomfortable, honestly, because I know that patient's gonna be like, she hurt me, and I don't ever want to hurt anyone. Or they come in your chair and they're already sweating, and it's just like before you even touch them. So the minute they feel pain, you're like, they think everything's gonna hurt. So just don't give them the opportunity. Some SRP patients I've done without anesthesia, and what I tell them is, we can try it without it. You don't have a lot of inflammation. You do have some spurs. We can try without it, and if it starts to bother you, if it's painful, we can come and get a dentist. Just let me know, because I don't want you to be in any pain. And then they're more relaxed, like, okay, I'm in control. She said that she'll stop. A lot of patients, when they're getting their teeth taken out or having fillings, the dentist will give them anesthesia. It'll probably wear off, or it won't hit the nerve right, so that they still feel it. And then they're drilling and they say, ow, ow, ow. And the dentist is like, oh, just one more, da-da. And then it's like, I've heard and seen that. And patients are traumatized. So by the time they come to get their cleaning, they're like, oh, is she gonna bust up my gums? What's going on? Like, I'm ready to fight. So just give that patient that option to feel like, you know what, I'm in control. They're not here to hurt me. Because people associate the dentist with pain all the time. I don't even know why, but they do. Even my husband, he do the same thing. He's like, you poked my gums. I'm like, I didn't. Your gums are inflamed. So just me putting the Cavitron around the gum line is going to pinch, and you're going to feel like I'm poking your gums, but I'm really not. So they don't understand. Give them that mirror and be like, you see here where it's red? I always use the analogy. Have you ever got a splinter? If you got a splinter in your finger, every time you go to take it out, it hurts. You don't want anybody to touch it. So if you have tartar in your gums, anytime I go after that tartar, it's going to hurt, because there's something in there that doesn't need to be in there. Once you take that splinter out, it feels better and it doesn't hurt anymore. So once I get this tartar off, your gums can heal and it won't hurt anymore. I always, always, always tell that to patients, and then they get it. They're like, yeah, because y'all all had a piece of glass in your foot or your finger or your splinter. Like, that's exactly what happens. Anytime you go to mess with it, it's going to hurt. So until we get this out, it's going to hurt. But I promise you, once it's out, you'll feel much better. And patients can get that. Because you're just saying, you have gum disease, your gums are inflamed, we have to get this bacteria out of here, this cat. They're just like, it's going to hurt, it's going to hurt. They're not registered, none of that. So
I have a question. What are you guys doing during this time that we're off? If I don't know if everybody's off work. Is everybody off work right now?
Yep.
No. So for those of you who are off, what are you guys doing to fill your days?
I've been doing a lot of CE.
Me too. Me too.
And I have a side business. I'm a health and wellness coach. So I fill my days with that.
Okay, I've been doing C's, and we've demolitioned our master bath. So
you at Home Depot, y'all the ones that's at Home Depot.
Me too.
Yeah. But that's it. Cooking, cleaning, eating, watching Netflix, doing C's, and in between that, cleaning up the mess that's been made.
I've just been sitting on the couch.
Sonia. Oh, you about to talk?
Go ahead.
I was just going to say, I forgot. I'm a homeschool teacher now, too.
I didn't hear the last part, Tamika. Did you say, what are we doing during this time, or did you say something regarding to hygiene?
Right. No, I was saying, what are you guys doing since you're not working in hygiene right now? What are some of the things that everybody's doing?
Right. I definitely been reading a lot. I've been reading a lot more often and watching a lot of videos and trying to learn new skills. And to be honest with you, I've been trying to work on my other business because I'm not sure about how this is going to work out for our career. And I'm into entertainment, and I was pursuing the acting career, which is why I always been a temp, because I'm trying to pursue an acting career, so I always need open availability. And Sonia, I'm glad you said that, girl, because I got something coming, and we're going to have to partner up because I've just started a business called Fit to Fab, and I'm going to be selling activewear. So
it's on.
We're going to have to partner up, girl. And I'm making my designs and my logos and all that stuff. It's still a long process, so I still have to learn this industry, and I'm very new to entrepreneurship. So I'm definitely going to want you to work with me, and we got to push out this stuff because I'm trying to promote health, and I believe that health is wealth. And a lot of what's coming from my company is coming a lot from internal. And I feel like when you feel good on the outside, it makes you feel good on the inside. And I have a very athletic background. I was always an athlete, and I love working out and staying in shape. I'm not perfect now, but I try my best. So we're gonna have to work together, girl.
Most definitely. Most definitely. I'm here for it. Anybody else doing anything?
Elvina, what you say you doing?
Just sitting on the couch. On this nice couch in my bedroom. Look at the TV. I can go from the couch to the bed. No, but seriously, I still teach. So our school, we went completely online. It's taught me a lot. I no longer complain about all of the work that my teachers gave me, or I've come to realize how much they actually put into our education. So I've been working on that. Right before the virus hit, I was in the process of hosting a CE course. And so I've been kind of trying to revamp that to see how everything is going to play out. So hopefully soon I can launch that. Other than that, just cooking with my son and playing board games. But that's something we've already would do anyway. So
I was taking 6 classes. I was finishing up my biology degree, and all of those classes went online. So I'm probably failing those classes now because I'm like, how? Now I'm home with my kids. So now they're on the computers during the day. They're all in school. So when I'm supposed to be in classes, some of that you have to you have mandatory attendance. So I have a 9:30 class on Tuesdays, and you have to check in online and be present in the class. It's like a webinar class. Well, I can't do that when my kids have to be in class with their teachers. So I sacrificed that for them. I emailed my instructors and told them, like, this is not going to work for me. Now I'm home with kids. Now I'm teaching kids. We only have, 2 computers, and one's a desktop, which the other is a laptop, and the buttons don't even work on the laptop. So it's like, it's not going to work for me. But because I'm not in class, like, I would go to school, my kids would be in school, and I would be learning. Because I'm not in class, they're like, we can record it and then send it to you. It's not the same. So I'm like, I didn't pay for online classes. I paid to go to school. So when I'm actually supposed to be studying zoology, ecology, or botany, which those are really hard classes, and we're doing a pig dissection and now it's online, it's like, how do you expect me to teach myself when I have to cook for my kids or all of these other distractions? So what I'm actually putting my time and energy into is just connecting with the BrownGirl RDH organization, doing these meetups. Like, we had bingo last night, virtual bingo. We actually did, we have a virtual lounge that we do where people come on and they just express their concerns. It's just an outlet for them to talk to somebody who, comes from their same background or who may have some insight or just some human connection. I know last Saturday we were in the lounge until like 3 o'clock in the morning, and people did not want to leave because they felt like it was just, they just needed that. Like, they needed a break, and I totally get that. So my biggest thing right now is just support the community that needs you the most, because there's a lot of things going on, but it's not necessarily for it's not necessarily for you. You have to figure out where you fit in, and I think that's the biggest thing. I should be studying. I have an exam coming up, but I just don't want to do it.
Can I ask you a question, Martell? So with your school, they won't allow you to, we gave at Prairie State, they gave the students the option to withdraw from class and then to pick it up the next semester where they left off. They're not giving you any options?
No, what they told us is that you have a pass-fail option, so it won't affect your GPA. So you either pass the class or you fail it, and then you can withdraw after you fail. So usually you have to withdraw before. So you can withdraw even if I get my fail grade, I can still withdraw, but I have to retake the class. So I'm just hoping like whatever effort that I put in there, because the classes started. When did classes start? Classes are over May 5th.
So probably in January, right?
Yeah. Yeah. It was January. So it's like for you to go all the way through March, have 2 months, a month and a half left, and then switch to online, and then you actually fail the class because it didn't work out for your situation. I lost my job. It's other stress factors that come into just sitting and going to school and studying. And then they're throwing everything at you online, and they're trying to figure out, they still want to get a paycheck. So they're trying to figure out how to teach their students. So they're going to do whatever they need to do. But on the other end, we're in the middle of a pandemic and we have families, and now there's other responsibilities. So I don't have time to sit on a webinar for an hour and a half when my kid's like, Mom. It's just a distraction. It's a different type of stress factor. So no, they said after you get your final grade, you can choose to withdraw and you have to retake the class and it won't count against you. But I paid out of pocket for my class. So I'm just like, that was like $1,200 down the drain. So I don't know. I don't know if I should withdraw now or wait till the end. I really don't know what I should do.
If you withdraw, they're going to make you repay for the class?
I don't know that. And I'm pretty sure they will, because they're not going to offer free classes because of COVID. Otherwise, they would have said that. Like, they already made it to where it's a pass-fail option. It doesn't affect your GPA. You can withdraw now, it won't affect you, or you can withdraw in June after you get your pass-fail grade. So I'm like, let me just try my best, email the instructors, let them know my situation. It's really hard to do labs online. We had to do a pond lab where you collect water samples and test them. And it's like, oh, that pond lab's online now. It doesn't make sense. So I'm pretty sure I'm not the only one that's going through it. So that's what I'm banking on. Like, everybody else is in the—
You're not.
Yeah.
I hear so many students complain, and it's really not easy learning online. I took physics online. Don't ask me why. It was the hardest thing I've ever done. So it's really hard to do online classes, but hang in there. You'll get through it.
Yeah. Let's hope everybody gets passed, just because it's like, and the teachers know, I feel like they know they're not doing their 100%. But it's one thing when you're being taught, you're sitting there listening, you're taking, but now I have to read your PowerPoint. What am I focusing on? You're not telling me what's going to be on the exam. And then they're like, you're going to have an online test, not proctored. Don't use any other resources. And you're like, you mean tell me I got my PowerPoint right here and I can't use it? So I haven't been using it. I'm just like, y'all gonna get what I'm learning. Like, so my past couple of exams and stuff, I haven't been passing them, but it's like, I'm not gonna sit here and act like everything's good. Like, once you start doing that and being and not honest, then it's gonna look like when you get to the end and you have to take this exam that's time and you fail it, it's like, but you pass all of these exams. So it's gonna catch up to you. So I'm just taking them without any notes. And then we're getting these emails like, we know people are cheating. Like, what do you expect? People are gonna cheat? So I'm hoping because I'm failing and I'm not cheating, they're gonna be like, okay, she's being honest. Let's just pass her. I'm hoping. Yeah. Anybody else?
Armani, how are you doing with school? What are you guys doing right now?
So for school, we actually have transitioned to online, and it's very different, of course, where we can't work on patients in their mouths. We can't do anesthesia. We can't do anything with patients. So the clinic portion is just really up in the air. And you guys talked about the advocacy ADHA and other organizations are doing, and that's where stuff like that's really coming into play. The didactic portion, like we're learning about right now, like the intricacies of the piezo, air polishing online, and I'm not getting as much from it because when I hear her lecture and talk about it, I just take it down. Now I have to look through a boring PowerPoint. So, but we're gonna finish all our didactic. This is our last semester, but the clinic portion, depending on when we can come back, we get to resume that. So, but it depends on when we're coming back, because we're the seniors, so we're gonna basically be third year dental hygiene students. They're gonna have the second years, the new second years, who we stopped right when they were just about to start using ultrasonics, and they were just really getting used to seeing patients. This is their first time seeing patients. We're gonna be bumping heads with them. And then they got the new first year dental hygiene class. They don't know they don't even know when they're gonna start. We don't even know if we're coming back for the summer. There's a lot of good things. Like, we actually do get to retake our courses, all City College of Chicago students, and we get to do it for free up to a year later, which is a blessing. And as far as classes, that's what's been keeping me busy. And I'm glad that I knew we have a really good chance. So I'm a student trustee for my community college system. I sit on with the board of trustees as their student member. So I hear a lot of stuff that they have going on, and it's really been a pleasure to work with them and see all the good things they're doing for the students. So I'm glad that during this time they're really staying strong for us, because we need that leadership. Everything is online, and we went online really immediately after we shut the schools down. And he got, I'm conferencing with you guys now on this loaner laptop. Every student, the 80,000 students we have at City of Chicago, everyone who's requested a laptop has gotten one. He ordered the laptops immediately straight away, and everyone has one, and he's starting to get hotspots. So at least we won't have a problem, accessing it. So
That's good.
Fantastic.
That's good.
That's it. And I spend my time cooking exclusively. I cook one meal a day. For everyone. I want to bring smiles. I go by Smile with the service on my social media, Instagram, and I cook a meal a day. I take requests, and I just show people, sometimes just with basic ingredients, just stay home and stay fed is what I say. So I'll make anything from meatloaf, pineapple upside down cake, Mongolian beef ramen, one thing a day. I'm gonna make steak today with yellow rice.
Are you good?
Yeah. I think so. No one's complaining. I'm the only one eating it. Yeah.
Oh my God, this is so exciting. It's a lot of entrepreneur spirits in here. And we would never know. Like, I see you guys all the time. I would never have known. You have to definitely share more so that we can share. Because
Nice.
I did not know that. And I don't.
Well, sorry to cut you off, Martell. I'm going to take a positive out of all this. And you said we're going to make it out if we were the offices or the dentists that were doing their part to be safe or put safety first and put good, healthy OSHA standards first. The dental offices that were trying to do their best to stay on top of infection control are probably the offices that are going to stay afloat. So I'm going to take that and run with it, and hopefully when this all ends, all of us will be sitting around saying, yeah, we made it together.
Yep. Well, this was great. Thank you guys all for joining us. You guys stay safe out there. We appreciate all of you. I'm going to post this video definitely probably Monday so that people can share. Or I might post it today. I don't know. You think I should post it today?
Yeah, why not?
Post it today. Okay, I'll post it today. It's Saturday. Thank you again so much. You guys take care. Virtual hug, everybody.
Virtual hug.
All right, bye.
Bye-bye.
Bye, everybody.